I'm Minerva Santiago. I am the founder of Legally Remote. I'm an elder law and estate planning attorney with offices in Alachua, and I serve clients throughout the state of Florida. So as most of you know, the choices you make now for open enrollment can have a pretty big impact on your healthcare coverage as well as your financial well-being for the upcoming year. And so my goal as an elder law attorney is usually to provide resources and to educate all of you with regards to the legal and planning aspects of aging. However, when it comes to something like Medicare and the complexities of Medicare, I find that it's essential that you speak with somebody who works with these kinds of options pretty much every day. And that's why I'm pleased to present you with Tracy Turner. She's our guest speaker for today. Thank you for joining us, Tracy. Tracy is a licensed health insurance agent, and she's based out of Orlando, Florida. She's been part of a family-run agency for 6 years, helping Medicare and Medicaid beneficiaries understand their options and make confident, informed decisions. Before working in health insurance, she spent over 20 years in banking and technology, experience that now helps her guide clients towards smart financial choices and simplify the enrollment process for those navigating Medicare online. She loves helping people make confident health insurance choices, guiding them with options for monetary savings and empowering them against the scams that can sometimes come with it, which we see very often. So I'm glad you'll be touching upon those. Just wanted to let you all know that any questions that were submitted during your registration process, if we don't cover them, I assume, Tracy, you'll probably cover them as part of your presentation because right, you will. If you
Some
won't,
of
then
them, yeah,
okay.
some of them look like I'll be covering it. Yes.
Okay, and then any that are not covered, I'll ask you, I guess, at the end of the presentation. And for anybody who joins and was not able to submit questions, you can still submit questions. They'll just be answered at a later time. But additional questions can be submitted to questions@legallyremote.com. Okay, so Tracy, I hand over the mic to you.
Okay. Well, thank you very much for inviting me, Minerva. I'm really glad to be here this evening. I have a brief presentation to go over Medicare 101. We're going to cover some of the changes that are coming for 2026, as well as we're going to cover some of the scams. We want to protect our seniors as much as possible. They're getting trickier every time. So I really want to cover some of the things we can look out for to try to protect everyone.
Great, thank you. And I believe your slides will be shared momentarily.
Okay.
There we go.
Okay. Thank you. Thank you. Okay. Good health and good sense are two of life's greatest blessings. I had to look up how to say his name. Publius Sirius. He was a very interesting, he wasn't a poet. It was a very specific thing in the first century where they had sayings even before Caesar. So two very good things. We want to keep our good health and we have good sense. So this afternoon, this evening, we want to try to make good sense of the things that we can learn so that we can have good health.
Very good.
Please. Thank you. So we're going to get into the basics of Medicare. And here we go. So look at the bottom. There's a lot of letters. I get this all the time. What do all these letters mean? So let's cover just a couple of them. So Medicare is a federal health insurance program, primarily for people 65 and over. There are some people that have entered into Medicare because of disabilities, and they were phased in after a few years, or some even from a very young age were able to get into Medicare. So Part A covers hospital care. It is skilled nursing facility and hospice care. Part B is your doctor's visits. It's durable medical equipment. It's any medications you get in the doctor's office, any surgical procedure. That's Part B. Part C. Now, you probably heard this on television. They say, do you have or did you sign up for Part C? They make it sound like it's something separate. It's not something separate. It is a Medicare Advantage plan. It will incorporate Part A and Part B and Part D, your prescription drug plan. I tell my clients, think of it as the complete plan. Now, whenever you see C, that should click in your mind. It's everything wrapped up into one. Next slide, please.
And just to make sure, Tracy, are you going to go over the differences between the Advantage and the Medic in another slide?
I sure will. I
Okay,
sure will.
perfect.
Yes. So
Okay.
when can you enroll? So when you turn 65, you have a 7-month window. It's the 3 months before you turn 65, the birth month, and 3 months after you turn 65. Some people will call you 6 months, 7 months ahead of time to try to get you to enroll, and you cannot enroll that early. It won't happen. If someone calls you to try to get you enroll, it's a scam. You can't enroll that early. If you're 65 and you're going to continue to work, you have 2 options. You can take Part A and keep working and delay Part B, or you can take A and B, but just know they will not coordinate benefits with your workers, your work insurance. They don't coordinate benefits. There's a little caveat there between 20 or more employees or 20 and less employees, but we won't get into that. But the most important thing to remember is if you delay Part B because you're going to continue on your work insurance, you have to make sure you have what's called creditable coverage. If it's a very small company and maybe they would not cover the things Medicare would cover, it's not considered creditable and you could be penalized. So it's always a good idea to run this by someone who would know. If your company is very large, it's probably not an issue, but if it's a smaller company, it would be a good idea to call Medicare and ask if their insurance is considered creditable coverage.
Can you clarify what you mean when you say that if you continue working,
Yes.
that Medicare will not coordinate with your private insurance? Does that mean so that in that circumstance, who would pay?
That's what I mean. If it's 20 and over employees,
Okay,
the employer insurance pays first.
got
If
it.
it's less than 20 employees, Medicare pays first, but they
Okay,
don't work together. You can't send one bill to your work insurance and then think that your Medicare will pay the rest. Doesn't
got it.
work.
Okay, thank you.
You're welcome. Next slide, please. What are your options after you are enrolled in Medicare? So you've got 2 options. Medicare Supplement. It supplements original Medicare. So it works alongside original Medicare, covering the Part A deductible. It covers the cost of hospital and going into the hospital, the co-pays. It covers the 20% that would be owed from Part B. And it covers all of those deductibles and insurance. You pay a small amount per month, and it is going to cover the cost that you would have to pay if you stayed on original Medicare. And the second option is a Medicare Advantage plan or Part C. These are offered by private companies, and they usually include different benefits such as dental, vision, hearing, prescription drug coverage. And neither one is typically better. It just depends on what your needs are. Let me ask, is this the last, was this the newest presentation that I just sent a few hours ago?
I submitted it, but yes,
Okay,
it
okay.
should be.
Okay, because we should get into HMO and PPO in just a couple minutes.
Okay.
Okay, so neither option is really better. There's a lot of things to consider. For some people, maybe they're very, very sick. They have a lot of doctors. They have a lot of specialists they need to see. So a supplement might be better for them. A Medicare Advantage plan, you do have to stay within your network whatever that is, an HMO or a PPO, and maybe you only have one or two doctors and you know your costs will be low and you can't afford a supplement. So there's a lot of research that goes in determining which one is better for who.
And can you clarify, please? I had briefly touched upon an issue that some of my clients have faced where they have a hospital stay and then they're discharged. They have the qualified hospital stay. They're discharged for that. I guess you'd call it like short-term, long-term care, if you want to call it that, for that 100 days of rehab.
Yes, right.
But some of them have faced the issue where is it, I guess the clarification is, does Medicare Advantage not cover that, or is it that only facilities that are within their network, which I think many of my clients seem to have a challenge finding?
Okay. And are you specifically talking about Advantage plans?
Yes.
Okay, yes. So we have seen this too. Yes, the Medicare Advantage plan would have to, that particular facility would have to be in network with that Medicare Advantage plan for them to cover it. And you're right, they only go up to 100 days. So beyond that, that moves into a whole new, I'm so sorry, you need to either move into a nursing home or home care. If there's nothing beyond that Medicare would give to someone.
But if somebody was on the regular Medicare plan, as long as the facility they were transferred to for rehab took Medicare, it doesn't matter what, if there's not like a network issue in that situation.
It could be. They could say we take Medicare, which means it has to be clarified. Either they take original Medicare only.
Okay.
And then you can go right in. Or if they're in the network with the Medicare Advantage plan, then they can be transferred there. So just saying, do you take Medicare isn't enough of a clarifying question.
Okay. So what should I guess patients be asking?
Right. They need to find out, let's just say it's Humana. They have a specific Humana PPO plan. When they're looking for all of the skilled nursing facilities that mom needs to be moved to, they need to start calling. Are you in network with this Humana PPO plan? Yes or no? And then you'll know if she can be moved there or not.
And would it be the same thing for the regular Medicare? Would they have to call and ask the same question?
Yes, they would.
Okay.
They would. Mm-hmm. Okay, next slide, please. Okay, thank you. This is the new one. Okay, Medicare Advantage plans, also known as Part C. We talked about that, complete plans. They have to cover everything original Medicare covers. It doesn't have the large deductibles and co-insurance. And in Florida, most of our plans don't have a premium. Very different in other states. We've tried to research that for some other clients. North Carolina, Georgia, exorbitant premiums. So we have it really good here in the state of Florida. Your plan is by county. So if you live in Lake County, we specifically look for the plans that are in that county and then determine which one would look best for you. So there's two different types of plans primarily in the state of Florida. The HMO, a health maintenance organization. Your primary care doctor is your gatekeeper. They are the ones that determine if they're going to let you go to a specialist or they want to keep all your services in-house. They can make that determination themselves. So if you have an amazing front office, your HMO might work beautifully for you. There are some people that say, I hate an HMO. Typically, it's because the front office isn't doing their job. That's usually what it boils down to. There's usually a smaller network of doctors. You will need referrals, and you cannot go out of network. You cannot. The primary care doctor is the one that will refer you to the specialist. And you might want to go to Dr. Smith, but they want to send you to Dr. Young, and they have the power to do that. They have that control. A PPO, preferred provider organization, you have the freedom to see any doctor in the network that your plan has. So if you want to go see a doctor in Tampa, you can just make an appointment and go. You don't have to have a referral. You can just skedaddle right over there. And you can also go out of network. If you wanted to see Dr. Smith and he's on the West Coast, but he's not in network, as long as your plan says it has out of network benefits and you call, do you take my insurance out of network? As long as you have out of network benefits, then yes, you can go. You may or may not pay more. Depends on the plan, but you cannot do that with an HMO.
Okay.
Next, please. Thank you. Medicare supplement plans. So here's more letters. We have F and we have G and we have N, high G. So all Medicare supplement plans must cover, again, what original Medicare covers. If you were to put Medicare supplement side by side, there's Florida Blue and there's United Healthcare and there's Humana and there's Aetna. There's many more. They all look the same. They all must cover the exact same thing. This is regulated. So there's no network of doctors. You can see any doctor who accepts Medicare. If it's a concierge doctor, more than likely, they've given up on all insurance and said, we don't want to take Medicare. We don't do Advantage plans. You'll more than likely be paying out of pocket for them. You pay one premium per month for a supplement, and you can think of it as like car insurance. You have it for when you need it. That's why you have a supplement. And like I said before, some people need to see many doctors, and maybe they're not in network with all the carriers that we looked up. They need a supplement. They want to keep their doctors. They need to be able to just go to the doctors they want to, and they'll just pay for that. But they won't pay every time they visit. There's no co-pays and co-insurance for that. Depending on the plan, we'll determine your out-of-pocket costs. So, for example, F plan, it pays the Part B deductible. A G plan, you have to pay the Part B deductible. So that will determine the costs. And if you want to set a budget, I like to think of it like this. If you want to know exactly what your medical expenses will be, you could get a Medicare supplement. You know, okay, it's going to be this month, this much per month. Boom. Now, with a Medicare Advantage plan, you have co-pays and co-insurance, and you pay as you go.
And just as a recap, so you have the Medicare Part A and B, which covers doctors and hospitals.
Mm-hmm.
And then you have this Medicare supplement plan, which covers the co-pays, correct? And
Yes, it does.
And what else does it pay in addition to the co-pays? Just for clarification.
Okay, thank you, because I didn't add that. That's it.
Oh, okay.
A Medicare supplement is medical only. So there's no dental, there's no vision, there's no hearing benefit. Some of them do include a gym membership, but you do have to purchase those separately. Mm-hmm.
Okay. And I think I saw on your first slide, gym membership was under one of the Medicare plans, was it? Or no?
A gym membership can be under some Medicare supplement plans. Yes.
Okay. Okay.
And typically they do include that with most Medicare Advantage plans.
Okay.
They do.
All right.
Okay, next one, please. So once you have your Medicare supplement, you must have a Part D drug plan. Medicare Advantage, remember, it's a complete plan, so it has A, B, and D, so it already has the drug plan combined. But once you have a supplement, you have to get a drug plan. Even if you don't take medications, trust me, you have to get a drug plan, or look in bold, second bullet. If you don't get one, you will pay a penalty every month you don't have one for the rest of your life. Wow. So yes, it's dangerous.
Do you know how much the penalty is?
I do. I have it right here because I have to calculate it for somebody on Thursday. 1% for each month you do not have a drug plan. And that's 1% of the base of the national base beneficiary premium. So that's $36.78 in 2025. So it would be, say if it's a 14-month penalty, it would be 14% times $36.78. So for this person, it would be $5.20 per month forever.
Okay.
Yes.
Good to know.
Yes. And during annual enrollment, you can determine if there's a better drug plan for you. That would be your time that you can make changes. Right now, we're in the annual enrollment period. I'm going to go over that next. And this would be the time you can make changes to your drug plan. So what is the best plan? Let's see. I hear this question all the time. Okay. All right, the best plan is the one that's right for you. This is why it's good to have somebody who's on your team really doing the research with you. There's a lot of things to look at. Where do you live? What can your finances handle? Are all your doctors in network? Are your medications in the formulary? And how much does it calculate per year or per month? Can you afford that plan? Or maybe you need to change to another one. Do you have special circumstances? Maybe you need travel to and fro the doctor. You might need out-of-state coverage because you're still working and you're still traveling, and maybe you need dental work. And there's special plans for people that have diabetes, chronic lung conditions, and cardiovascular diseases. So there should be several factors that are asked every time you start to take a look at your insurance again.
Yeah, I mean, when you see the questions like that, I mean, it just makes it so obvious or so clear that choosing your plan isn't something that you should just maybe ask your family member about or a neighbor or whoever. Like it's so detailed about your circumstances, your health, where you live, all of that.
Right,
It's highly
exactly.
recommended that you speak with somebody who is very familiar with the plans and how they work.
Exactly, exactly. I'll tell you a story. I had someone call me a little while ago, and he's asking me all about this plan, and this is the plan he wants. And then he says, and my brother lives in North Carolina. I was like, oh, well, we have a problem. You cannot have that plan.
That's great.
Okay,
Right.
so the best plan is the one that fits all your criteria, is the plan that is best for you. So your needs are different from your spouse, they're different from your brother, your coworker. So whoever's assisting you should really conduct this needs analysis to help you with the decision that's right for you. So when can you change? Well, right now is the annual enrollment period. It's October the 15th to December the 7th. And this is when you can switch your Medicare Advantage plans. You can change your prescription drug plans. And within this time period, if you are on an Advantage plan and want to go back to a Medicare supplement, this would be your window of opportunity. You can go back on into, you'd have to qualify for a supplement if you had already missed your guaranteed entry window, and you'd have to go through underwriting to requalify. And then also, don't forget, get your prescription drug plan. And in January, February, March, that's your open enrollment for Medicare Advantage plans. So in January, if you decide, I don't like my plan, I missed annual enrollment, I was in Europe, and now I come back and I miss my time window, you still have these 3 months to change for January to February, February to March, March to April. So the key is, like you're saying, it's really important not to just set it and forget it. Like, you really need to just take a look at it. You might be perfectly happy, but you should still review your annual notice of change to see if it's still working for you. How to get financial help while enrolled in Medicare. There's a few different ways. There's a Medicare savings program. It's called the Medicare buy-in. It helps people based on your financial structure to get some additional help. There's something called LIS, low income subsidies. These things can help pay for premiums, co-pays, and prescription costs. Give back benefits. There are some plans now that actually give money back as a credit for your Part B premium. So that could help with a little bit of extra savings per month. chronic needs plans, we talked about that for people that have certain health conditions. They can get the give back as well as possibly some additional food help, food or utilities help. You do have to qualify for that, as well as right below that is the dual Medicare, Medicaid plans. You have to qualify for those, of course, but if you have a chronic condition, chronic health condition, the government is willing to give you some extra financial assistance to help with food, over-the-counter, utility assistance, but it is a qualifying condition.
Are the two options that you mentioned at the beginning, the Medicare Savings Program and the Give Back benefits, do you have to financially qualify for those?
The first one, yes. The second one, the give back benefits, no. Those are wrapped up into Medicare Advantage plans, and if that plan works for you, it's amazing.
Okay, so for the first option, would they just look at income, at your income level?
Yes, it's income related, yes.
Okay.
So is the extra help, Ella, yes, income related.
Thank you.
Welcome. Medicare doesn't provide everything. So some people think Medicare will give them home health care or long-term care or cover large dental expenses. It does not do that. Once one person asked me, please go over dental. Well, dental, are you talking about dental under original Medicare? Because they really don't cover much of anything. It could be an extraction due to a mouth infection prior to chemo, treatment for a complication for head and neck cancer treatments are just a couple that I found. So it won't cover anything for dental. So if someone has a question about dental within their Medicare Advantage plan, there is a way to narrow down exactly what that plan will cover. The carriers do have the detailed benefits on exactly which dental code they will cover. And we can get that information for them. But if somebody needed those additional services, it's important now to plan for those in the future and really understand where those gaps in coverages are.
So just to clarify, regular Medicare does not cover routine dental.
It does not.
Okay, so in your experience, what do most individuals do? Do they have to get some sort of separate plan, or do they pay out of pocket, or either of the two?
Right. So if someone has a Medicare supplement, they get a separate dental vision plan. That's what they would have to do. And someone that has a Medicare Advantage plan, they're really scaling down their dental. They're scaling them way down. They used to be very rich. If someone is on, as we stated, those chronic needs plans or the Medicare Medicaid plans, they have a higher elevation because they know they're quite sick or in financial need. They have a higher dental benefit. But for the most part, even people now that have a Medicare Advantage plan that has some dental, they need additional coverage if they really need assistance with big dental bills.
Okay.
So what's new for 2026? Hot off the press. We've been looking for this for weeks. Probably due to the government shutdown, we could not get our hands on this information. The Part B premium for 2025 is $185. For 2026, it's $202.90. This typically comes out of your Social Security check. You don't even know it's coming out anymore, but it is coming out. Your Part B deductible, if you just have a Medicare supplement, it's $257 for 2025. 2026, it'll be $283. Your Part D maximum out of pocket. This works with both a Part D plan that's separate and the Part D plan that's wrapped into the Medicare Advantage plan. The maximum that you'll pay in 2026 is $2,100 for your medications. So that's what the plan pays in with a discount, and then you pay your copay. So whatever that amount is, once it hits $2,100, the plan will pay the rest of your medications for the year. And the Part D deductible, so more and more of the carriers are incorporating a Part D deductible, so it won't be any higher than $615 next year. It can be no higher, but each plan is different. So they're not all 615. There are some plans that still kept it at zero, between $0 and $615. That's our window. Okay. Scams. I'm sorry, Minerva, we're going over a little bit. Do you want me to wrap that up quickly?
Well, I think the scams are important.
Yes, yes.
Yes. So go through them, please.
Okay.
Yeah.
Go ahead right ahead. So everyone's probably heard what is free grocery money. They want their free grocery money. They're saying anything from $4,000 to $8,000. It's exorbitant numbers. So please be careful. So when you hear something that sounds too good to be true, we know that it probably is. So there is free grocery money out there. Free. You have to qualify for a Medicare and Medicaid plan. That's exactly what those plans are. As soon as they get you on the phone, it's a bait and switch. That's exactly what it is. They determine that you don't qualify for Medicaid, and boom, they put you in something else. Before you knew it, you didn't even say yes, and they've put you in another plan. A common tactic is pretending to offer these free benefits. They grab your personal information, and before you know it, you're getting a new card in the mail. Medicare will never call you unless you have an appointment with them. They will never call you. A carrier they don't call you unless they're trying to flip you into something else. An agent, myself, I can never call you unless I have your permission. It is illegal for me to do that. And if something doesn't feel right, please hang up, call the carrier back, and ask them what they needed. Just please be careful. Okay. Next slide, please. Thank you. So we just touched on this, the free grocery money. This is the bait and switch. Yes, Minerva?
Oh, no, I was just clearing my throat. Sorry.
Okay. Okay, the free grocery money, once you find out that you don't qualify for Medicaid, they will switch you to something else. So verify. If someone I have one client say when someone calls and say, "Is this John Smith?" He says, "Who's asking?" He will never say yes. And as soon as he doesn't say yes, they hang up on him. So know that you are on a recorded line when they call you. They want to catch you slipping up and saying yes to anything, and then start their illegal business. And right now, the worst case scenario, we have 2 clients who unfortunately gave so much information thinking they were speaking with someone reputable, and they now have no Social Security checks coming in. They have wiped them out, and they're rerouted their Social Security checks. I don't even know how this happened, but we have to be very, very, very vigilant.
Yeah.
Yes. Okay, next. So lastly, people that are using impersonations of, say, grandchildren, using artificial intelligence. There is so much information that is on social media with children, young people. Their voices and videos are all over the internet, and they can easily take the voice out, put it into a website, and create lies. So we have, it's called a grandparent scheme. You'll get a phone call late one night from your granddaughter who says she's in jail and needs money, and it's not her. It's one of these impersonation AIs. So just pause, ask yourself, does this sound realistic? It's bred to be an emotional, high pressure, make a decision now type of call. See if there's some other way you can verify the information. Can you hang up and call right back? Would your granddaughter really call you to bail you out of jail? Would that really happen? Just if there's any way that you can call to verify the information, that's what you should do. And if you think you've been targeted, you've already sent money, please call the police, make a report, and you should call the National Elder Fraud Hotline. So what do we remember in our little brief Medicare 101? Know the basics of Medicare. This is your foundation. Once you know that, you know what your options are. You should really speak up for what's important so you can ask for it. There's still some really great plans out there in the state of Florida. And if you can, use a broker. We shop, we research plans, we do a lot of heavy lifting to see if we can show you everything that's available that would work for you. Maybe you didn't even know they existed. And be vigilant, please. There's a lot of scammers. They're getting better all the time. If you're not sure, hang up and call your health insurance company immediately.
Awesome. Well, one thing that I did want to bring up that I forgot to bring up previously with when you were going over coverage was I recently learned that Medicare is covering it's called a guide program for dementia individuals that are diagnosed with dementia. And I recently learned that they cover like respite for caregivers, but you have to have the diagnosis of dementia. But that only applies to individuals who have Medicare Part A and B. It doesn't cover it for Advantage plans. So for anybody who watches this and either has dementia or has a loved one with dementia, just be aware of that. Make sure you ask questions. I mean, I think really it seems like, Tracy, first of all, you need to find out if the providers you're currently seeing are going to be on the plan that you're thinking about selecting.
Right.
Yeah. And I know that what I'm mentioning now about dementia and that respite, that can be something that's unexpected, but fortunately we have these year-round options where you can switch plans. So that's helpful.
Yes, right. And if it's original Medicare only, then we would just take them off the Medicare Advantage plan and they would go right back to original Medicare.
Okay. Fantastic.
Yeah.
Okay, so for anyone that didn't get this, oh wait, I wanted to make sure that we covered all the questions.
I see one. Yeah, I see one that wasn't covered.
Is it? Well, you go ahead. I'll let you.
Okay. Oh, I'm sorry. Where do we find out what Medicare covers? So that's kind of a tricky question. Are we talking about original Medicare? If that's the case, there's a website to go to determine if it's original Medicare. It's medicare.gov/coverage. You can actually type in there maybe a dental implant or shoulder surgery, and you can see what Medicare will cover. But if it's a Medicare Advantage plan, then it should be outlined in the evidence of coverage. It's very detailed, everything that's covered. If there's anything that's in question, that'll be a phone call to the carrier and determine if they'll cover it. Some things that aren't covered by the FDA, some things that are experimental, they may not be covered yet. So that would be a question to the carrier to see if there's any exceptions.
Okay. And I know that's somebody had a very specific question, but unfortunately, I know that would require them to reach out to you personally, which was a question about Aetna and what changes are expected for next year and whether that's the right program for them. You're free to reach out to Tracy after or within the next week or so, sooner rather than later, given the limited amount of time that's left for open enrollment.
Right.
And I think that's it. You did everything. You covered everything that the recipients wanted to ask about. So thank you so much for that. So if anybody has any addition, I know that they could submit questions to us, but if anybody wants to actually work with you, first of all, clarify as far as there's no fee for you to, like, if somebody calls you to look into plans for them, there's no fee for you to do that for them, correct?
Right. No, we do extensive research, looking up doctors, looking at medications, presenting the information. The research is elaborate, but there's no charge for that. We just hope that you would like to work with me.
Good. Very good. And do you have, I'm not sure, did your last slide have your contact information or are you just going to verbally share it? Okay, it did. Yeah. Can we get the slides back up by chance? There we go.
Thank you.
All right. Well, thank you so much. Thank you, Tracy, for all of this wonderful information. Yeah, I think that's it for tonight. If anybody has any questions, you can reach out to either of us, and we hope the information was helpful.
Thank you for having me.
Oh, you're welcome anytime. Have a good
Okay,
evening, everybody.
bye-bye.
Bye.